Good afternoon. First, I'd like to thank the organizing committee for inviting me to this conference. The reason I'm here to speak about COVID is that globally, Taiwan is praised as a success story in this pandemic, given the fact that we are so close to China, but only have around 500 cases and 7 deaths. But I have to humbly admit that back in the year of 2003, when SARS broke out, we were in a terribly disorganized, chaotic situation, a total disaster. That's why my presentation is entitled No Pain, No Gain. I hope our lesson shared in the next 15 minutes can stimulate your thoughts on where we were and how we may move forward in this global crisis. Since the beginning of COVID-19 in January, life here in Taiwan has been nearly normal. We never had a lockdown. No community transmission for 6 months. People wear a mask to go to school, work at office, shop at a mall, and dine out at restaurants. Daily activities continue. The public is encouraged to wear a mask, but only as a requirement on public transportation. Our border has been always open to citizens and now open to non-tourists as well. The only requirement is 14-day quarantine after entry. People worry about disease importation, but trust the government can effectively stop community spread if it happens. But 17 years ago, the picture was differently totally. You see sad faces when a hospital in Taipei City was locked down because of delayed notification of SARS outbreak. More than 1,000 patients and workers were forced to be quarantined inside the hospital with no clear distinction between safe zones and dirty zones. Therefore, hospital transmission continued. A total of 150 persons were infected. 35 of them unfortunately passed away. One of the newspaper headlines was the first sacrificed healthcare worker because of SARS, Chun. Chun worked at the outbreak occurring department and took care of the index patient, got infected and died of SARS despite intensive care. The attending resident physician of that index patient also passed away. This tragic story and large number of deaths have traumatized every single person in Taiwan, even until now. It's a major event that illustrated failure in managing SARS during that time. Going back to the beginning, the SARS outbreak started in China in 2002, but took several months before China reported to the WHO and the WHO issued global alert. The first wave came into Taiwan in February and March, was brought into control, and did not lead to local spread. The good initial results unfortunately created complacency about 0 deaths, 0 case. SARS became a success story to tell, and the story cannot fail. Therefore, the government wasted precious time advertising achievement, but not filling gaps in border control, surveillance reporting, and hospital preparedness. In the end, underreported cases increased in numbers, and large hospital outbreaks became real. When the outbreak was over, 346 cases were confirmed, including 73 deaths, and 11 of the deaths were among healthcare workers. Massive quarantine was the key, but the society already paid a heavy price to bring SARS to an end. The price was public trust. It's a major crisis. Big issues included face mask shortage, disorganized quarantine management, inadequate healthcare and lab capacity, dysfunctional media handling, poor government coordination, and high-degree stigma towards patients and frontline workers. I can't go through details of each, but I think these issues are no stranger to you when dealing with current COVID-19, which is why it's said history tends to repeat itself. But Taiwan already learned a painful lesson. Strong commitment was made not to repeat the traumatized SARS history. Infrastructure reform immediately started to strengthen each dimension. We set up information system to capture official and unofficial epidemic intelligence as quickly and early as possible. We revised the law to enable a strong and a centralized command system in the case of public health emergency. Resources were mobilized to establish a healthcare network that is able and ready to isolate and care highly contagious patients, with workers in full protection. And more importantly, make clear, transparent communication a day-to-day practice. So when emergency comes, the spokesperson system is ready and the media already knew credible and a familiar source to contact. For example, the healthcare after SARS has new legal and financial infrastructure for infection control. By the Communicable Disease Act, all hospitals must hire infection control specialists. Their income is secured even if they don't see patients. And for preparedness and response, Taiwan CDC may designate any hospital for isolation and treatment. And in return, government covers its own training, allowance, reimbursement, and compensation for revenue loss. Taiwan CDC also fully covers costs for isolation and care. Patients do not need to worry about hospital bills. And to protect patients' privacy, the law also requires media respect confidentiality and not disclose personal identity of patients. This law turned out to be very useful in handling media events related to all infectious diseases, including HIV. The reform in public health infrastructure also benefits HIV outbreak response. In 2004, a large HIV outbreak among injection drug users triggered rapid response across Ministry of Health, Ministry of Justice, Ministry of Domestic Affairs, and local governments. Resources were quickly mobilized, regulations revised to allow harm reduction program as a legal and affordable option for key populations. After 2009, alarming increase of HIV among MSM were seen, while treatment as prevention and PrEP gradually became government policy and therefore ART services need a rapid scale up. Thanks to earlier preparedness efforts, most hospitals had infectious disease specialists that can provide quality HIV services, and ARV and PrEP's accessibility was expanded quickly. In the next few slides, I'll quickly go through early phase of COVID-19 in Taiwan, illustrating the usefulness of our preparedness efforts. In contrast to lack of intelligence from China in 2002, this time we captured the intelligence about Wuhan outbreak on December 31st, 2019 early morning from Taiwan's largest web chat forum. The initially posted messages already indicated positive result for SARS virus, way before Chinese health authorities announced a new coronavirus on January 7th. This piece of early intelligence triggered our next moves on verification with China and WHO, border control strengthening for Wuhan travelers, and so on. From day one, based on SARS suspicion, we began onboard health exam for all flights coming from Wuhan. Preparation such as reporting and testing was underway, and because of suspicion of credibility of official data in Wuhan, in mid-January, we sent 2 experts to Wuhan, and their face-to-face discussion there confirmed human-to-human transmission has happened. So we quickly activated the centralized command system and started daily press conference. These were all done before the WHO declared COVID-19 as a global public health emergency. The January response came with a crisis of face mask shortage because of the long traditional holidays of Asian Lunar New Year. During that time, all manufacturers were not producing masks, but public demand surged for at least 8-fold. We quickly released 35 million pieces of medical masks from stockpile and worked with Ministry of Economics to boost massive production after the long holidays. Appropriate distribution became a challenge, as many people were stockpiling for personal use, leaving essential frontline workers short of masks to wear. Our IT minister came up with using digital health insurance card as a gateway for ID-based mask purchase and pickup. Everyone was eligible to buy the same amount of masks every 1 or 2 weeks. This effectively solved the mask crisis. Another innovative IT solution was Digital Fence, which is a police-linked digital tracking system to monitor quarantine compliance. Signals generated by mobile phone of the quarantined person are continuously monitored. If the signal is out of range from the quarantine spot, police department is immediately alerted and the police will track down the escaped person. Using this technology, we allow most quarantine to be enforced at home if a single room is available, therefore reserving the capacity of quarantine centers and hotels for accommodating higher risk contacts. Healthcare system is definitely much more prepared than 17 years ago. Public and private hospitals at central, regional, and local levels all participated in this response, and capacity mobilization was quick. So far, only one small event of hospital outbreak occurred, affecting 4 workers. There was neither hospital lockdown nor healthcare worker deaths, unlike what happened 17 years ago. Interestingly, reminders of not stigmatizing frontline workers, they are heroes, were reinforced voluntarily through social media, unlike the heavy SARS stigmatization in 2003. Public health messaging is conducted through social media and a daily press conference. The Minister of Health, who is also the commander of COVID-19, always chaired a press conference, participated by CDC officials and infectious disease experts. Every day, the commander gives an update on new cases, investigation results, policy, and answer media's questions until no question is raised. Because of that, the commander's face becomes a highly recognized icon that represents transparency and accountability. High-level public trust is shown by a survey in April that 95% of the businesses in Taiwan were satisfied with government's efforts to control the virus. In conclusion, I'd like to reiterate no pain, no gain. We learned from SARS mistakes and spent the 17 years preparing. Therefore, to countries that believe they are still in crisis, please turn crisis into opportunities, seize the chance, take COVID-19 resources and momentum to prepare your health system and community for the next pandemic. Our story shows that these efforts and investment will pay off, not only to SARS or COVID-19, but also benefit HIV response, TB response, and other public health emergency events too. I know that some of you are worried about funding or manpower relocation from HIV programs to COVID-19. Instead of worrying, I'd encourage you all join advocacy for preparedness of pandemic investment in your own country, so as a group, you have a chance to be integrated into the agenda, such as viral lab and research capacity, community engagement, and destigmatization. Finally, if there is one single lesson taken from the Taiwan experience, I'd repeat, infrastructure must be ready before the next SARS-like outbreak happens. It may take another 17 years, but if you do it, you'll see the results. Thank you.